want to cross to Bjorn Lomborg now, who, as you know, heads up the Copenhagen Consensus Centre. Good to talk to you again, live from Copenhagen again, Bjorn. Fascinating to see what you've been looking at when it comes to dealing with this pandemic around the world. We know from the start it's a balance between the health crisis shutdown and the economic costs. What have you found?
Exactly, Kenny. It's great to be here. So, fundamentally, we've got to recognize that it also has significant cost to shut down economies. We've all realized that now, but obviously we got to ask ourselves, how much can we help and what is going to be the cost? Now, as you also mentioned earlier, we have good studies, for instance, from the US that actually indicates a moderate slowdown or a sustained reduction in social interaction probably makes sense because we're very rich. But this is not the case for poor countries. So if you think about poor countries, they have much younger populations, so they're probably going to have less of a benefit from cutting their infections. They have much lower hospital capacity. So even if they reduce the curve, they're still going to get overwhelmed. And then, of course, they also have many, many other problems. So we actually did a study together with the Malawi National Planning Commission, and we found that overwhelmingly, even just a moderate shutdown is a very bad idea. It actually costs much, much more than the good it'll do.
I'll come back to those developing countries in a moment, but by way of comparison, let's start off with countries like Australia and New Zealand, which are wealthy. We have the benefit of being island countries. So we've been able to very extensively shut off our borders and shut down our economies, crush the infection rate. But we know this is, and also massively build up our health system capacity. But we know this has come at a huge economic cost. So there's a big argument here about the cost versus benefit, but we can pay for that in years to come. Have we gone too far in some of the developed countries?
It's hard to know because, honestly, there's only one peer-reviewed study on cost-benefit, and it looks at a moderate social distancing. So it basically looks at a Sweden model, and what it finds is that just passes a benefit-cost ratio. So it actually generates slightly higher benefits than the costs it incurs. But remember, these are huge costs. We're talking about a cost of, in US dollars, about $7 trillion, but benefits and saved lives of about $12 trillion. So overall, they say this is a good idea. But going further and shutting down your entire economy could very well not be a good investment, simply because you will save fewer extra people, but you'll have much, much higher costs. And also remember, these are only economic costs. But a new study out of Sweden actually shows that the social cost, that is, the cost of just being locked down, is also enormous. It's probably in the order of 9% of GDP by itself.
Well, now, when we look at the developing world, we're just starting to see the damage being unleashed in South America, in South Asia, starting to see the pandemic hit badly in Africa as well. Not only is it more difficult for some of these countries to get social distancing, they also don't have the health capacity to build up. So in many respects, they just don't have the option, do they, to go for the sort of economic shutdown, the sort of strategy that we've employed?
No, we're working with the government of Ghana, and the finance minister in Ghana went out and said, look, we can't afford to do a shutdown for more than 3 weeks. People run out of money, and that's true all over the developing world. You have huge problems for many people just simply realizing, can I feed my children? So there's a very definite trade-off that's very different from us that can actually afford to shut down. And what we find is it'll have two dramatic costs. One is the economy. The other one is schooling. Shutting down schools means that kids will learn less, hence they'll become less productive when they become adults. And what we found in Malawi was that the cost of shutting down the economy is about 1 year of GDP. The cost of shutting down schooling is also about 1 year of GDP. So the total cost for Malawi, remember Malawi is one of the poorest countries on the planet, is probably around 12 billion US dollars. It'll save about 7,000 lives. But remember, you can save 7,000 lives not for $12 billion, but for $3 million if you spend the resources well. So you can save 4,000 times more if you focused on saving the people who die right now from HIV and all the other diseases.
This is the sort of thing that your centre has looked at around the world for decades. How can you best use foreign aid and the like to actually save and develop and deliver prosperity for the most lives? Now, even in our wealthy countries, you get this debate that you're talking about the economy is to sort of put a price on someone's lives, that lives should always trump the economy no matter how much it costs. But especially in developing, I mean, that's a crazy argument for all sorts of reasons, even in wealthy countries. But in the developing world, of course, lack of money every day is costing more lives than a pandemic like this.
Absolutely. I'm always struck with this argument. And as you point out, in rich countries, we can make the argument that we're certainly willing to spend more. But remember, there's never enough resources. And there are lots of people we could save better in healthcare situations. But certainly in poor countries, when you look at a country like Malawi, they can probably save about 7,000 people, according to the Imperial College models, 7,000 people with mostly from corona, if they did a moderate lockdown. But remember, every year, 22,000 people die from HIV in Malawi, and we could save almost all of them. So the question here is very bluntly, why is it we're so focused on saving 7,000 lives at an enormous cost and so little focused on saving 22,000 people at much, much lower cost, thousands of times cheaper?
Just on that, what's your assessment now on where the pandemic is headed in South Asia, in Africa, in South America?
Well, look, and again, I'm not an epidemiologist. My understanding is this could be bad, and so there's a real cost to this. This is not something that we should just be sort of blasé about. But the problem is, as I mentioned before, the idea of reducing flattening the curve. Sorry, I couldn't remember.
No, I'm with you. Flattening the curve. Indeed.
Yes, is only valuable if you can actually have a healthcare system that you can reduce it down below the capacity of. But you can't do that in most developing countries. They're always going to be overwhelmed. And so the reality is we have to make sure that the corona crisis doesn't turn into an education crisis, that is, kids don't get education, but also that you don't stop dealing with tuberculosis and malaria and HIV and all the other diseases. We're seeing that in rich countries, and again, we can probably afford that better, but you could very easily imagine a situation where because you don't, for instance, vaccinate kids, you end up with many, many more dead. There's one study that showed you could end up with 141 dead for every person you save from corona if you don't vaccinate kids while the corona crisis is going on. Now, of course, we're trying to do that, but we really got to make sure we don't make bad choices, especially in the developing world.
Hell of a challenge, a hell of a balancing act in any country, but especially for developing countries. Bjorn Lomborg, we've spoken many times before about your work on climate policies and this same sort of cost-benefit analysis. You've got a new book coming out soon. Hopefully we can talk to you again in a couple of weeks about that.
That'd be great.
Thanks for joining us. Bjorn Lomborg there from the Copenhagen Consensus Centre, talking about that balance that's so difficult. We talk about it every day in this country, the economy versus the health system, the sickness and health and lives versus the economic cost. Well, in developing countries, they're just starting to deal with that. They're incredibly difficult decisions to be made.